Hi, welcome everyone. I actually forgot which button to press to start the live, so I was scrambling around. Thank you so very much for joining me. Welcome to those of you watching the replay. And if you're lucky enough to have caught me live, you're very much welcome. I'm Dr. Sylvia. This is AskAwayHealth, where we talk about everything that is relevant and relatable to your health. So I'm really glad you could take a few minutes to join me this Sunday evening. So we're talking about endometriosis, and in a moment we're going to go into, it's not really such a new topic, but I think it's one that we just need to keep having a conversation around, because that's probably the only way that we're going to be able to manage to make an impact and change the current trajectory or status in terms of poor diagnosis when it comes to this condition. But before I do that, like I said, it's so good to have you here. How are you guys doing? Where are you watching me from? Let me know in the comments section. And I really do want this to be kind of interactive today. I will try not to do too much teaching, because I've got endometriosis videos and playlists already on the channel. So you can learn so much more in terms of detail. And of course, I'll touch on a few things like symptoms and causes and all that. But I really want us to have a conversation around this. Share your experience or the experience of somebody you know, if you feel free to do that, or just chip in your thoughts in the comment section about what we should be doing in terms of the poor diagnosis when it comes to endometriosis in this country. Right, why did this topic come up this week in particular? Well, I don't know if you caught this little snippet on Sky News in the UK yesterday, talking about nearly 9 years to come to a diagnosis of endometriosis. So I'm going to play a little bit of the clip. We're going to hear from the spokesperson for Endometriosis UK, and hear their thoughts really about this condition. And then I'm going to look into why, in my opinion, as a family doctor, general practitioner, as a woman, why is this taking such a long time why is it taking such a long time for a woman to get diagnosed with this condition? What are the pitfalls? What are patients not getting right? Definitely, what are medical practitioners not getting right? And what about the healthcare structure and process could be improved? So that kind of conversation is what we're going to be doing tonight. So let me start by sharing my screen, and then we can look at this Sky clip and then take things from there. So just bear with me a minute, guys. Okay, so hang on. Oh, if you do that, will it let me? Okay, right. So I hope you can hear me. Yes, I'm sure. I just checked my audio, so yes, that's fine. Right, so let us get on with this.
Well, I'm joined in the studio by Sancha Alasia, the national spokesperson for Endometriosis UK. Thanks so much for coming in to talk to us about what is a huge issue for so many families, women, their loved ones as well, impacted by this. It's remarkable when you think it's not months it's taking years to get a diagnosis.
That's right, Simon. It's taking on average just under 9 years for women and those assigned women at birth to get diagnosed with endometriosis. And that diagnosis time has not changed for a long time. And as you can understand, that will have debilitating effects on how we manage the condition and how we live our lives.
So why is it taking so long? Is it, I mean, it must be a combination of factors. I also know that a lot of women, like the ones we've spoken to, say they feel gaslit, they're not believed. Is there also an issue with the NHS that needs addressing?
I think there does need to be more resources into the NHS, more educational awareness for medical practitioners. It can be a difficult disease to diagnose because a lot of the symptoms may play into other diseases as well. But that's where the education and awareness comes in, so that they can pinpoint that very early on.
Yeah, and so when women do go, what kind of symptoms do they have? Because it's wide ranging, isn't it? Tell our viewers who might not know what to look out for, what they...
Okay, let's pause them there for just a moment and set the stage, because our viewers might not even know what endometriosis is. So let's just start from the beginning. I'm just going to put on the, actually, there's a better one actually. Oh, I thought I had the second one on here. Oh, crikey. Okay, we're just going to have to bear this image. And then let me pop my disclaimer on first, because as you might know, if you've been on the stream before, we're here to provide medical education, health information, health education that helps to signpost you in the right direction. And this is not by any means providing medical advice to anyone. I can't, as I'm not your medical practitioner, because I don't have your medical background. I don't have the necessary information to be able to provide that kind of guidance. So you should, with this information, do more research, ask questions. It empowers you to go forward to your own practitioner and hopefully be able to have a conversation to make better decisions about your own healthcare. So that's our disclaimer. So back to that image, I did think I had one that contains the womb, the normal view of the womb, and the view of a womb with endometriosis, and now I can't find it and I've plugged out. Anyway, let us go back to this one. So we're talking about endometriosis, and endometriosis is a condition where tissues that are similar to the one that normally lines the inside of the womb are found in other parts of the body. So that's what endometriosis is. In the United Kingdom, we are learning that the rates of diagnosis have become significantly worse over the last 2 to 3 years. And we're now looking at an average of 8 years and 10 months. That is just under 9 years for a diagnosis. So from the time a woman presents to her general practitioner or starts to complain of related symptoms to the point where she has the established confirmatory tests and they say, right, this is endometriosis, it's taking 9 years, nearly 9 years, which is horrendous because we're going to come to the symptoms in a moment, and then you can just imagine living with that kind of existing with all those kind of things, or some of those kind of things for a woman. And the stages could differ. We appreciate that some people could have mild disease, some people could have moderate or severe disease. So that's what endometriosis is. We think that's probably, and this is information from Endometriosis UK, that in the United Kingdom, perhaps about 1.5 million women, and those assigned female at birth, are currently living with this condition, regardless of race or ethnicity. And that's those who have been diagnosed. So if they've not been diagnosed, they don't have, those numbers are not in that group. So there's probably more, which is even more alarming. So let's talk about the symptoms of endometriosis. I've got a nice slide which takes us into that. So what happens? I've just explained that endometriosis is tissue that normally is in the womb lining finding itself outside the womb lining. Now, what happens to the womb lining every month after month after month in a woman who is menstruating is that blood is shed, menstrual blood and tissue is shed. And it's that tissue, that lining of the womb, that internal lining that's being shed month after month after month, that bleeds. So imagine if this is happening where this tissue happens outside the womb. And this is what contributes these issues that we have around endometriosis. I think it's also important to say that it's a condition that affects women of childbearing age or women who are menstruating. And commonly, we're more likely to see it in those sort of aged from their early to mid 20s onwards. And, that's where the big burden of ill health it can cause exists. So here are the symptoms that you might have. And this is really important to be aware that it can have such a wide range of symptoms, and that can contribute to one of the problems with making the diagnosis, where sometimes us doctors are not getting it right as quickly as we can. So pelvic pain, and actually chronic pelvic pain. So I don't just mean a spasm or an episode of pain, pelvic pain in the lower part of your body happening once or twice. This is a recurring pain over several months, going into years. And this, I talked about people living with this condition. So it's become a norm. They've sort of taken it as this is their normal. This is really distressing. So imagine somebody living with pelvic pain and chronic pelvic pain. It might settle a little bit and then come back. It might be worse around the time of the period, and it never goes away. So there are different grades to the experience of pelvic pain that women might report. Painful periods, experiencing deep painful sex. So what that means is with deep penetration during intercourse, women experience pain. And again, imagine living with this. Imagine the impact on one's sexual well-being and libido, and of course, one's sexual relationship. Some women may experience painful stooling with their periods. Some might also experience painful urination. And why is this happening? Let me swap screens and bring back that other picture so that you can see. So this image shows the endometriosis deposits. So what you have is when this tissue that's really supposed to be inside the womb lining, and it starts to grow outside, and commonly you find it outside the womb, along the fallopian tube, in other parts of the pelvis. So these are sort of the dark brown chocolate kind of lumps that you're seeing on the screen at the moment. So they could press on the other organs, or they could be so closely aligned with the other organs, they're causing pain when passing urine, because you have endometriosis deposits close to the bladder. Or close to the bowel or rectum, so that when somebody is trying to open their bowels or pass water, it is very uncomfortable. If you're just joining the stream, you're very, very much welcome. I just noticed a couple of people joined in. Thank you so much for popping in, even if it's just for a few moments. We're talking about the misdiagnosis of endometriosis and looking at why it's happening and what women can do to help ourselves improve diagnostic time. And it's not just women, there's so many different reasons. It's not just the person with the condition that can do something. There are many other things that should be done that could hopefully help us get better at managing this condition. So let me swap back to the symptoms screen. Okay, so we've talked about painful urination, back pain, again, for the same reason we've talked about those deposits happening outside the womb, so they can just end up in different parts of the body and cause problems because there's excessive bleeding. Since you're having tissue outside the womb, you're also getting bleeding in different areas. You're getting heavier and painful periods, irregular periods that can lead to anemia, so low hemoglobin levels, leading to exhaustion, tiredness, and of course that sets off its own roller coaster of just very poor quality of life, being very unwell in oneself, but just managing, as many women and girls sort of try to do. And something's not quite right, but they've gone here and maybe they've had some tests which didn't really show anything. And they think, okay, maybe it's this or maybe it's that. We try to excuse it away and it becomes a normal way of living. So that could be one of the experiences that somebody has, and they end up sort of waiting for some time, or it's not considered when they go to see their doctor for so many different reasons. And that can explain why women get into that cycle or that pathway of experiencing these symptoms for years before they are diagnosed. So irregular periods, painful periods, heavy bleeding periods. Trouble with fertility, of course, is another big one. And that might be one of the reasons that a woman comes to see her doctor, because now they want to start a family. They've endured these symptoms, not really thought too much about it. It might have been mild, maybe moderate to some extent, not severe enough for, very significant complaint, or maybe they did complain and somebody thought, and the doctor thought it was something else. And so not until the point where they think, right, we want to start having a family, they come off maybe any form of birth control and then can't have children. And then, that's when the tests start happening. That's when they're referred to gynecology, when it could have been done maybe some years ago. And not necessarily because of the fact that they were trying to, they were having trouble with fertility. I'm struggling to get my word out now. Not necessarily because they were having problems with fertility. They could have been referred years ago if those symptoms had been considered as possibly related to endometriosis, and gotten the test done, because that time gap, that waiting a few years, only allowed for the disease to become more severe. So that's the problem with having those delays. The disease is progressing and getting more severe. And then the last one I have on there is bloating, nausea, vomiting. I think you would agree with me that, these are so many different, it's such a wide range of symptoms, isn't it? Apart from things like bloating, nausea, and vomiting, anemia, then pelvic pain, the bleeding. When a woman comes to the doctor with these symptoms, especially comes to us as family practitioners, there isn't any blood test that you can do to say, right, this is endometriosis. It would really need for you to sort of sit down and put together the symptoms. And somebody might just present with one of those symptoms or just a couple of symptoms. They may not have the painful sex. They may not have the heavy bleeding, but they might have something. And the first thought naturally may not be endometriosis. And so unfortunately, we go down the route of something else, which we say, well, okay, for these heavy periods, perhaps we can use the pill to see how that goes. And then some time is spent in that direction before coming back if the pill or whichever method of birth control that was suggested did not work. So I'm trying to lay the ground for why somebody might come in with these symptoms and then they go down the wrong route, not because the doctor isn't doing their job or they don't know what they're doing, but because it's a complex condition. And so you would need to be sort of thinking really broadly, or you might need more than one symptom to demonstrate that, right, actually we should be thinking about endometriosis. So this is what the lady was just about to express in the Sky clip, and I'm going to put the link to that in the description box below for anybody who wants to watch it. And you're welcome to do, because I think it's really very useful, again, to share with friends and family members. But the conversation I wanted us to have, and you're welcome to join in it, share in the comments section. But the conversation I wanted us to really have was about what is it? What else can we do about getting ourselves in terms of diagnosing, reducing the diagnosis time and the time to treatment from 8 years and 10 months that it is on average at the moment in the UK. I think one of the points that the lady, the spokeswoman, is going to make in her video is that they're looking at trying to reduce that time to under 12 months by 2030. So a lot of work needs to be done. Here are my thoughts about some of those things that can be done. I would love to hear from you. I've already started mentioning one of them, and that's the fact that the symptoms are quite complex and variable. Sometimes you might come to the GP and you have bloating, nausea, and they do an examination, they do some tests, and there's nothing else untoward going on. And so it may be thought, right, this sounds like irritable bowel syndrome, or you might come with another different sort of symptoms and they treat you for an infection or PID. Those kind of thoughts could happen initially, and that could be why there is a delay in actually somebody thinking that this is probably endometriosis. But I think we're changing in that regard in terms of how we're making the diagnosis. And there's a lot more awareness. And this brings me to the second point, which is about awareness and education. So let me talk about education first. It is true that we do receive training around women's health conditions. Even as family practitioners, we do rotations in gynecology. Excuse me. We do rotations in gynecology and in obstetrics. And of course, there are changes in treatment that happen over time, new research and so on come out. It's possible that you might have a doctor who does have training in gynecology, has training in obstetrics, and is doing their best, well-intentioned best, to be able to identify the symptom. And perhaps they're not up to date with not up to date with current research. So that's something that we need to be looking at in terms of medical practitioners. Are we up to date with our training, with any new research that's come out in terms of assessing patients and making diagnoses for endometriosis? There's some doctors, family doctors, who have special interest in women's health, and because, such as myself, and because we're so much involved in things related to women's health, we attend courses regularly, we're just trying to update, we're involved in talking about women's health issues, it tends to be a lot easier than a family practitioner who doesn't have that particular specialist interest. Even though they are trained in basic women's health issues, it might be a little more difficult for such individuals. And so you have to look at, is there something else that we can do in terms of improving the awareness of those doctors who do not deal with women's health issues as often as those who have an interest? Of course, this is talking about family practitioners different from the specialists. The other thing that we can say about awareness is related to you who has the symptoms and what you need to know. And that's why I'm doing this video, because I'm really interested in helping us to understand our bodies better, helping us to realize when something isn't right and something isn't functioning as well as it should. And be able to tackle I think sometimes the cultural mindset, particularly when it comes to us women, believing that certain things are normal. Heavy periods, they always have that in my family, it's normal. And perhaps there could be some delay in going to find help. And during that delay, the condition itself is progressing. So there's something to be said about awareness and education. And I've put the link to Endometriosis UK website on the chat, in the comment section. And let me just share because I think it's just good to have that available. So let me just share their website as well. This is Endometriosis UK. Excuse me a moment. Okay, so this is Endometriosis UK. Visit the site, have a look at the different bits of information that they have talking about endometriosis, getting support, getting involved, research, and all sorts of things that they're doing. Very useful site to be aware of if you have endometriosis or know somebody who has this condition. Okay, right. So that's two things. So number one, reason why it's difficult or why there could be a delay in diagnosis. Not that these reasons cannot be overcome, they can. But this is probably what is on ground, and this is probably the things contributing to the problem that exists, why there's a delay in getting the diagnosis. So first of all, complex condition, different symptoms that don't necessarily fit into a specific endometriosis box. In primary care, in the GP surgery, we don't have any blood test or any specific test. Even a scan might not tell you that it's endometriosis, especially at fairly early stages, because it might not show you any of the deposits or any lumps or things looking abnormal around the womb in the early stages. So you probably need the definitive diagnosis, which is a laparoscopy, to look inside the womb itself, to look inside the pelvis itself and work out, oh, this is abnormal, this looks this way. You're not going to get that in your family doctor or general practitioner's office. We don't have that. You would need a referral to a specialist. So that can also explain the delay in the diagnosis sometimes. Then, of course, there's lack of awareness and lack of education, so that when we see women with chronic pelvic pain, some doctors might not immediately be thinking, we should have endometriosis as a possibility. So even if you want to treat them for possible irritable bowel, bring them back after a couple of weeks and see how is this going on, how are you getting on. And if no progress is being made, then you have to start looking at something else and not keep this woman for 1, 2, 3 years that they've got IBS. Meanwhile, potential endometriosis condition is progressing. We've talked about diagnosis just now. I think I just mentioned that it's not something that you can easily diagnose with a blood test or a urine test. Wouldn't that make life so easy? Then you could say, right, this is most likely the condition. That's not the case. It still needs a laparoscopy to be able to look into the abdomen, look into the pelvis to identify those deposits that I showed on the earlier slide. Because even an ultrasound and MRI sometimes might not detect it unless it's at very advanced stage. So that means being referred to gynecology, dealing with possible wait times, and before a specialist is seen and before the test is arranged. I think that can also contribute to the delays in diagnosis. Okay, right. Guys, what are you thinking? Is there anybody who has any thoughts sort of in that direction? Anybody who has, yeah, oh, hi. Hi, Michelle Wilson. Please finish your thoughts. Thank you so much for joining, and please finish your thoughts. I think you are going to type something, but didn't finish. And then we have Mina. I like that name, Mina. Thank you very much for this video. Very much welcome. I'd love to hear from you. Like I said, I didn't really want to do too much teaching today because a lot of my lives, I'm always busy chatting away. So let me know what your thoughts are in the comment section. Let me know what you think about this condition, what your experience has been. Because now I'm going to go into one cause that's fairly sensitive, and women talk about how they feel their symptoms are being taken, how they feel they're being treated. It's not really a very nice, place, but let's talk about it because we need to deal with it. And that is about the gender bias in medicine, or the fact that historically, when it comes to women's symptoms, they are treated differently to men. I was reading something recently, and we've talked about heart conditions in women, the symptoms being different to the way that they can express in men. That's a whole different live stream, but let's just be aware of that. A woman could be having a heart attack. She might not have the classic chest pain, central chest pain symptoms and all that. But I was just reading something recently. I think this is from a study in the US where they're thinking that actually blood pressure, normal blood pressure levels should be set at different rates or different readings for men and women. And because the physiology is different, I mean, again, that's a whole different conversation. But the point that we're trying to make is you can't assume that when it comes to healthcare or healthcare provision or symptoms, that men and women are the same. There is a clear difference. And so women's health issues often be marginalized. There's been some other kind of interest. Pain is frequently downplayed or attributed to something else. Oh, they're being emotional, or they're being this. And the symptom is not taken very seriously. To be foolhardy and unfair of me to say that many women do not have that experience. And if you go to Endometriosis UK, I think back in March, there was an article they published based on some research that they had done looking at women and asking them to respond in terms of their experience from medical practitioners when they were trying to get about their symptoms when along their journey towards the diagnosis of endometriosis. And it makes for very unpleasant reading. Women talked about not being taken seriously enough, being, dismissed, really. It's not very, very nice. So they feel as if they've been gaslit, that gaslighting, not being taken seriously, being treated as if it's all in their heads, that kind of a thing, really unfair. So again, this is present in healthcare systems and it needs talking about, it needs standing up. If you feel that somebody who is your doctor is not taking your symptoms seriously or not listening to you, you need a second opinion. You need somebody who will actually sit down and, listen to what you're saying. I encourage women to keep diaries of symptoms, keep timelines of symptoms, come to the clinic or your consultation with a friend or somebody to support you, so that when you're having a conversation, if you feel that the individual or the practitioner you're speaking to isn't taking things forward with you, you've got that support, or you can decide you want to take it to somebody else and find a second opinion. So it's really important to address that. I think that is also a contribution to why we're having that experience with delays in diagnosis. So let me just have a look. I don't, Mina, this is a good question. I don't know. I think it's enough to go and see your doctor about. I mean, I'm not saying specifically relates to you, but it's possible. If you go by my list of symptoms, let me bring it up again. I don't know if you were here when I was going through my symptom list. So you've got pretty much, well, this person, this woman with nausea, fatigue, and a protruding tummy has got pretty much, the symptoms that I've put on that page. So there's a possibility. And I think they definitely should be having a discussion with their doctor. And it is fine for you to say, doctor, I'm concerned I might have endometriosis. That's fine. As a general practitioner, actually, I like to find out from my patient, what do you think might be going on? It's not because I haven't got an idea, but you know your own body. You might have a family member who's had some other, similar symptoms. You might even have had a friend who had similar symptoms. And that could help us try and pull things together. It's about having that whole conversation, working with you as a patient to get to the bottom of what's going on. So I think in regards to this question, I can't answer yes or no. I certainly think it's a good reason to go to your doctor and have a conversation about the possibility. But yeah, and you're welcome. You're very much welcome. I mean, that's why we're here, and I hope it's useful. I do think it's really important about taking that conversation forward with your doctor, and just sharing that concern. And yeah, please, if you think, based on what you've heard, all they have to do is say why they think it's not, and that might include looking at the symptoms again, or saying, you know what, it's been going on this long. Why don't we do this and do that, and then let's arrange for these tests. There's no harm in having that kind of conversation. I think it's really important. Okay, so we are talking about why we're having misdiagnosis when it comes to endometriosis. Why are, well, not necessarily family doctors. It's not just family doctors. the other, specialists might also be going down the different routes in terms of other things and not necessarily focus on the endometriosis. There are different reasons why we might have these delays, and we're just trying to tackle some of the ones that, we've thought about. Healthcare system here in the UK, we're dealing with a really serious NHS workforce crisis. We have very long waiting lists. So people are waiting several months for routine procedures, routine appointments and referrals, taking a lot longer than what they used to be 5, 6, 10 years ago. So they were already coming into place before the pandemic. The pandemic just made things a whole lot worse. So that is something that is tricky. You might be in a state or in a country where there is a large burden on the healthcare system, or there isn't even enough money to be able to provide the necessary equipment, operating theatre or even specialists to be able to do those procedures. So that could be the challenge, not necessarily that is a long waiting list. So there are different reasons why there may be that delay. So it's really important. And now we're talking about policy, we're talking about government and governance, and how can they make changes that would improve the experience of patients. So this is an important reason why it might be something going on. Okay, another thought, and I'd love to hear from you guys what you think. But this thought is about perhaps the focus has really been on, let me take this off, hang on a second. Yes, another thought is that perhaps the focus has really been on fertility. When it comes to endometriosis, that is, the focus has really been on fertility instead of chronic pain management. I don't know how best to put this, but what I'm trying to explain is this. Fertility, of course, is very important. And traditionally, we've looked at endometriosis through the lens of how it impacts fertility, which is important. But it seems as if there's a group of women who, for them, fertility is not really the issue, but it's about the experience of pelvic pain. So the point I'm trying to make is that when it's the issues about fertility, yes, people will refer you a lot quicker to gynecology. But do you think that there seems to be a reticence, or maybe they're less quick to carry out that referral when you have pelvic pain? Isn't pelvic pain that affects the quality of life and so on? Isn't that also important for women? So perhaps there is that mindset, perhaps. I'm not sure. I'd love to hear what people say, and whether that's been their experience, that because they weren't necessarily coming to talk about or looking for children, but looking for a referral. And actually, now that I think about it, I came across somebody some time ago who had been getting pelvic pain for several months. And to be fair, the problem was trying to get into the GP surgery, and the pain wasn't such that it kept her away from work. You see, that's the tricky thing. Women have adapted, and so they can get on to work, deal with the pain. It's there, but they're still going about their business. That's what women do, going about their business. The pain is there, and they try to get in. It's not very easy or convenient to get in to see the doctor. It's not an excruciating problem that, puts them down or takes them to the emergency room, and they continue to live with that. Those are some of the challenges that I think we're having, and we need to, again, educate ourselves about these, about dealing with conditions like that, because that delay, please remember, that delay can mean that the disease is progressing, that it might be worsening, the stage is getting more severe. So I would love to hear your thoughts, especially if you're watching the replay. What do you think? What's been your experience? Have you had endometriosis? When did you get diagnosed? Were you one of those who had to wait such a long time? How did it impact you? Or do you know somebody, maybe a loved one or friend, who had that experience? What did they go through? And what are your thoughts? What was it that led to the delay? Was it some kind of gaslighting? Was it, your GP did all the right things, however, so and so? Or was it when you got to hospital, there were other complications? Or just generally, system isn't working as well as it should, and so on? What was your situation? I would really, really love to hear back from you. So it's not a very long stream today, but I'm so glad for those that were able to catch me live. And of course, please give this video a like, and let me know what you think. Don't forget to subscribe to the channel, of course. I've got a few good videos coming up in the next couple of weeks. I would really, really love your support. And thank you so much for responding to the community post polls and quizzes. I really enjoy making them, and it's so good to see people responding to them. That's really amazing, and I think people are picking up knowledge from that and maybe sharing with people. Thank you so much for engaging and being part of a wonderful community here at AskAwayHealth. All right, guys, we're done. Thank you so much for watching. I will see you again soon. Have a great week ahead. You're welcome. See you soon. Take care, Mina. Bye-bye.